Hey everyone, my name is Kayla, and I'm doing my presentation on marijuana legalization. So let's just get started. Okay, so when discussing the legalization of marijuana, there are many controversies between people and lawmakers. There are discussions around the overall impact on revenue, health, crime, and substance abuse when legalizing marijuana. One of my articles discusses the impact on healthcare encounters after legalizing marijuana in Colorado, and the other discusses the impact it has on law enforcement in states that are surrounding Colorado. So these articles will help understand how much of an impact of legalizing marijuana has on the public, and it can help understand possibly why other states are hesitant on legalizing it in every state in the United States. So, my first article was titled Marijuana Use and Related Healthcare Encounters in Colorado Before and After Retail Legalization. So, the data was used to try to answer two key questions for public health: how legalization would impact marijuana use, and whether there would be an increase in adverse health events caused by marijuana use. So, they used population-based surveys, poison center data, and hospital discharge data was used to look to answer the questions. So there was data from several age groups, including young children and prenatal exposure, so pregnant women. And the primary concern with young children is the risk of them accidentally ingesting a marijuana product that's not safely stored, such as like edibles or like anything like that. And then, according to a child health survey in 2016, 8.3% of homes in Colorado with children aged 1 to 14 had marijuana in them. Over the years, the number of marijuana related calls to the Poison Control Center of Colorado have increased, as well as hospitalizations involving marijuana in children aged 0 to 8 years has increased. Colorado has been working to reduce the risks of accidental marijuana ingestion by children by enacting stricter packaging regulations and educating people on proper storage. So this article basically just kind of discusses like what all happens, after marijuana has been legalized, and like how it affects children and the whether they end up having to go to the hospital for ingesting it, or whether they're exposed to it and stuff like that. And so the conclusions of this article was while legalization has not noticeably impacted marijuana use rates, it has increased the healthcare encounters with marijuana related issues. So almost 6% of pregnant women in Colorado use marijuana during pregnancy, and the same number use after giving birth and while breastfeeding. And then around 2% of children 1 to 14 are in homes with improperly stored marijuana, meaning they're just kind of like easily accessible to children for them to ingest or, whatever. And so poison center calls and hospitalizations involving marijuana are rare with children aged 0 to 8. And adolescent marijuana use rates are stable, but poison center calls reporting marijuana exposure involving 9 to 17-year-olds have increased, and hospitalizations with the marijuana code have tripled. So while adolescent rates are stable, they are also higher than any other age group, and there's a sizable portion using daily or almost daily. So meaning a lot of adolescents in the area are using marijuana on a daily to almost daily basis. Public health agencies should monitor marijuana use via population-based surveys and monitor healthcare encounters involving marijuana, such as the Poison Control Center calls and the hospital discharge data. And of course, this can be more intel can be gained on this from more research. So if there's increased research funding, then this can help even gain more intel on the severity and the risk factors. And so my second article was titled The Impact of Marijuana Legalization on Law Enforcement in States Surrounding Colorado. So since the legalization of marijuana, many people have been questioning the impact it'll have on crime, substance abuse, and state revenue gains. So this article used a multi-stage cluster sampling on municipal police departments and sheriff offices in Kansas, Nebraska, and Wyoming, because of their close proximity to Colorado, and these states have not legalized marijuana in any form. So there were surveys that were sent out to police departments in the neighboring states to see the officers in the department overall perception of the impact of marijuana legalization in Colorado that has been had on them. And so the methodology for this study, it was an exploratory study that was used to explore the law enforcement's perceptions on marijuana and the legalization of recreational marijuana use in Colorado from the officers in neighboring states, like I'd said on the previous slide. So the sample collection took place from June to September of 2017. Each state was split into 3 different clusters, and random sampling was used in each cluster. So basically, each state was kind of broken up into 3 different little areas with the counties and everything. And so the surveys were sent out in either packages or email to 97 sheriff departments and 128 municipal police departments. And the departments were asked, like the chief or the sheriff of the department was asked to give the surveys to the officers and to fill them out and send them back. And they had the option to opt them out as well if they didn't want to do it. So it just really depended on what they decided to do. And so the response rate was really low. It was about 33.6%, so not a lot of officers actually responded. And the survey consisted of about 44 questions. And so the results, it was to determine if states and clusters differed on the perception of the impact, 4 separate one-way analysis of variance tests were ran. And the overall model was statistically significant with an R2 value of 0.401, meaning that about 40% of the data was captured in the line of best fit on the graph. So it was pretty statistically significant. There were some limitations of the study, including the low response rate, as I had said, because, if some of the chiefs or the sheriffs decided to not participate, then none of the officers got a chance to respond. So there could have been officers that wanted to participate, but they couldn't because their chief or sheriff didn't want to. So it didn't happen. And so another limitation is that some departments are much larger and cover a larger population, so their opinions on marijuana legalization may differ than officers in a rural area. The result of this study represents more of a rural police departments than the urban ones. So a lot of more smaller departments participated in the survey versus the ones that were in the urban areas. And the overall conclusion of the study was that law enforcement officers in states bordering Colorado overwhelmingly disapprove of the legalization of recreational marijuana. And all 3 states reported having problems with enforcing the law. So meaning that after Colorado legalized marijuana, the other states around it really disapprove of this. The police departments don't like it, and they're having trouble enforcing the law, probably because it's possible that people are probably going over states' lines, to purchase marijuana and then bring it back into their state, or whatever they're doing with that. So that is it, I believe. Those are the references, the 2 articles that I was given. So thank you guys, and hope you guys have a great rest of your week.